First, good afternoon, everyone.
Good afternoon.
I'm so happy to see you here. I know that it's now time to try many classes. I know you haven't decided yet to come, but I'm happy that you are here. All right, so before we start, I'd really like to hear about you. Before I introduce myself, I'd like to hear a little bit more about you, who you are, what is your research area, which department you belong to, and if you like, you can say something about your background. Just 30 seconds around the table. Can you start? Wow, okay, very interesting, guys. Thank you very much. I think all of you are in the right place. Previously, so this is our third year having this class, and previously we actually had people from computer science, so it was a bit tricky because this class is not really about learning how to code or how to use some application to make games, that kind of thing, because I think what is common amongst us is that we are medical, we have medical background, so we don't really we're not experts in computer programming and things like that. But this course is going to help you to know exactly how to collaborate with an expert in programming. Okay, so the class is a half course. It's made of 7 classes, and then you will get 1 credit for 7 classes. And then it's every days or every Fridays between 14:45 and 6:15. I think our last class will be around 25 November. The director for this course, maybe most of you know, it's Professor Kiara. Unfortunately, he's not here today. He's on a business trip. He would have loved to come here and see you and greet you and tell you more about why he is offering this course. But I hope I can do that on his behalf. And then my name is Bhekumusa Lukhele. Please call me Becky. Becky, yes. I think it's easier like that. Just call me Becky. Okay. I think the big question is, well, why am I standing here? Because actually, as you can see, I'm also a student, probably just like you. But why am I standing here instead of maybe Kiara instead standing here? I'll explain that a little bit. First, I have a very compelling reason for thinking about gamification. In my country, one of the most serious problems we have, public health problems, is HIV. So when I came to study in Japan, I was like, oh my God, so much information I got here in the School of Public Health. And I was thinking, wow, well, maybe it's because they don't have enough information. And I went back to my country to look now carefully at how things were. And I found actually there are many these kind of things, posters, billboards, even big billboards, warning people and teaching people about HIV, how they can prevent it, what it is, how they can be safe. So the problem is not knowledge. It might be knowledge in addition to other problems, but knowledge is not the only problem that they have. So in my master's study, I conducted research to find out what is the problem. And I interviewed some people in focus group discussions, and one of the striking discoveries was that people were experiencing HIV information fatigue. Yeah. And coming to think of it, HIV was first noticed in my country around the 80s. So now it's been 30 years of the government doing big efforts to try to warn people against HIV. So people are getting tired of these things, because if you open the radio, you hear something about HIV. If you go to your school, you hear something about HIV. If you are in the road in the bus, you hear something about HIV. If you walk in the streets, billboards, HIV. So people are getting kind of used to the information and starting to ignore the information. So I was thinking to myself, well, under these circumstances, how do we engage a fatigued audience? I asked myself this question and I consulted widely. How? The people need the information, they need the behavior change, but they don't really take it into their minds. They don't really practice what they learn. Why? So I started to think about a new topic to me, which was gamification or serious games. So from 2013 to today, I've been learning about serious games. So I would like to share the little things that I know about serious games with you. I started my quest to learn about serious games by attending a conference. It's called Games for Health Europe conference. I can really encourage you to join. I think they have it every year if you're really interested. So I joined this conference. I saw many kinds of different games. Some exciting, some not so exciting, some interesting, different kind of games. But I could notice one thing consistent throughout. The games were excellent. They were very nice games. But I could tell that the person who designed originally, who had this idea, is a developer. I could tell. And then I could tell that the person who designed this game, this person is health background. I could tell very easily. So the games were not really, at that time, were not really merging the game constructs and the health constructs. They were not really merging very well. So I could easily tell. And most of the games, I thought, okay, it's a very nice game, very nicely designed, very nice aesthetics, but I cannot play this game 2 times or 3 times or 4 times. Many games, not even in this conference alone, even games online that I see every time. So I decided to learn from that, okay, I can see some weaknesses and I can see some strengths, and how can we improve in my own intervention. So I started speaking to some experts in the field. I started attending game conferences even around Japan. And that is how I arrived at, sharing my knowledge with some students about serious games. So about this course, we have 3 simple objectives. The first objective is to introduce students to serious games. In Japan, we are very lucky because most Japanese have already played games almost extensively. Japan is, in the world, I think it's leading in terms of expenditure in games. So we're lucky in Japan. Most people already know a lot about games. And then next, we'd just like to help students understand how to get started in gamifying a certain public health intervention. Since all of you are already working in public health, thinking about public health, so maybe you'll start to think about how you can start developing your own individual interventions. And then lastly, the course tries to encourage students to design measurable health game interventions. This is one of the hardest things to do, how to design a game that can be measured in clinically or epidemiologically important constructs. It's easy to measure the dose of the game, like how many times people play the game, up to what level, or some metadata inside the game. It's easy to measure those, but are they really epidemiologically important to stimulate change? That's the part that's a little bit challenging and hard to do. So we'll try to give you ideas on what we have done and what other experts in the field have done. So in a nutshell, we're going to start by trying to understand what games are, and then look at how to get started. Then finally, do some practicals by seeing real games that are actually being deployed in people. And then also, you'll have a chance to make presentations about some game idea that you might have. Before I continue, I just want to state that, as public health, researchers, we, not only us, I mean everyone, have gotten very good in identifying risk factors. most of our studies, including myself, I identified factors associated with risky sexual behaviors in my master's paper. So we are very good in identifying those kind of risk factors. And sometimes we are also good in measuring some effects of certain interventions or drugs or therapies, etc. We're almost relatively good at those things. But in terms of designing an intervention that will last and have effects over a long period of time, I think it's one area that we still need to improve on as public health officials. If you've taken social epidemiology 1 and social epidemiology 2, I mean, you have understood the insights into how to develop those kind of interventions, which this course tries to also address that. Let's go beyond identifying the risk factors. Let's try to have some input in identifying or implementing solutions to those risks. So I mentioned that we've got different experts that will be coming to share with us their knowledge. Next week we'll have Mr. Norihi Sawada. He is an executive of a serious game publishing company located in Tokyo. He'll tell us about types of serious games and gamification. Then next I will share with you intervention mapping and starting to think about evaluating a game. And then also Mr. Wada will come again to share with us some game mechanics and what things we can link with the qualities of a game. And then also there's Assistant Professor Fujimoto from the University of Tokyo. He is one of the founders of a serious games organization in Japan, one of the first. So he'll also come in to share with us his perspective on trends and where he sees the industry in Japan and globally. And then also I will share with you an intervention called Swaziolo that we have created together with experts in developing company that tries to solve the problem that I identified earlier on. And then also we have got Associate Professor Matsuguma from Kyushu University. He will share a lot about rehabilitation games. So please look forward to the next coming lectures. I hope you will enjoy as I have enjoyed over the past few years. And then the scope, the general overview of this class will be gamification, serious games, and simulation learning. And then the evaluation, 30% will be participation, group work, group discussions, and you will need at least 30% in total to be credited in this class. Okay, sorry, 60% to be credited in this class. So today we start on this part. So we're going to progress throughout this progression line. And then I just want to mention that maybe in Japan, usually in a class, sensei speaks a lot, teaches you a lot, and then you go away. But in this class, I really encourage active participation, not only listening, but active participation. So please feel free to ask questions, feel free to comment or share your thoughts in any of the topics, even topics that spark you to think about something unrelated to the class. Please feel free to share. Okay? All right? Okay. Thank you. And then also, how many of you have played a game in the past week? Yes? 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 You played a game? Did you play a game? Did you play a game? Whoa, sugoi! This is the first time. Sugoi! Wow! I'm really interested in what games you played. Yeah, so I always encourage to play some kind of game. It's always nice to, once you take this class and you start reading about these things, you'll start noticing some things that you didn't notice before, which I found very interesting. Some of the the interesting things I learned from this class is something called curve of interest. Every time I see a movie, I see exactly this thing that I learned. How the plot is, how the climax is, how they keep you focused in the movie for the first 10 seconds you watch the movie. Same applies in games. So you'll start seeing many of these things as you play games, the next game you play.